This is Rachel Wheel, and you are listening to Atomic Dog Radio. It's a blast.
All right, quiet, guys. I mentioned ASEC. And ASEC is the Animal and Surgical Emergency Center, and it's a multi-specialty veterinary referral hospital located in West Los Angeles. They have board-certified specialists, cutting-edge 24-hour critical care, state-of-the-art equipment, and a team approach. And their goal is to work in partnership with your referring veterinarian for the benefit of your pet. And we have from ASEC, Dr. Raviv Balfour. How are you?
I'm great. Thanks for having me here today.
Thank you, thank you. You know, in reading a little bit about you, one thing I saw is that you went to school in Illinois.
I did. I grew up in Chicago and went to University of Illinois.
Me too.
Go Cubs, go Bears.
Skokie.
Bulls won tonight.
Did they?
Yes, they did.
Wow, all right.
So a sports fan we have on our hands.
Yeah.
A quick question. Are we allowed to call it ASEC or is it ASEC?
You know, we call it ASEC.
Okay.
When we talk on the phone, so
Okay.
that's totally fine. It stands for Animal Surgical and Emergency Center, but often we'll say this is ASEC.
Yeah, it's the easier way to do it. Just making sure so people out there know that we don't make the wrong approach when we're bringing our pet in. We want good care, Dr. Balfour.
Yeah, absolutely. Well, I mean, we're more than surgery and emergency, but there was way too many initials if we called ourselves the Animal Surgical and Internal Medicine and Radiology and Cardiology and Oncology.
It'd be like a law firm.
Yeah.
That's what it would be like.
I'd hate to be the receptionist, have to answer the phone every day.
So tell us a little bit about how you got involved with ASEC and what your job there is.
Well, I after school I did an internship with the at the time we were the Department of Surgery of California Animal Hospital, and subsequently I went off after my internship. I was inspired by the surgeons there and went and did a surgery residency in Boston, and then came back after my residency and passing my boards, and now I work as a surgeon and one of the managing partners at ASEC. And we've grown from just a department of surgery to now a multi-specialty hospital.
Now, how many years have you been with them?
I've been there since 1999.
Wow. So you've really helped. You've been a big part, as a partner, a big part of developing and growing this company.
Yeah.
This hospital.
Yeah, a part.
A part. He doesn't want to look at each turner. He's like, not all of it. Don't make me say that. A big part, I'm sure.
No.
So when you say you're a surgeon, do you have a specialty in that, or?
The nice thing about being a veterinary surgeon is that I can do any kind of surgery, orthopedic, neurologic, soft tissue. I tend to do mostly orthopedic surgery, but I really do enjoy doing all different kinds of surgery.
All kinds. So you don't have a favorite?
Well, I mean, I love doing knee surgery, and I love doing arthroscopy on elbows and shoulders. Doing minimally invasive surgery is fantastic.
With the lasers? Is that how it is? Or?
Yeah, sometimes the lasers, and sometimes we just use the scope and instruments, and we're able to do it through very tiny incisions.
Wow. Now, the hospital, I mean, you call it a hospital, I assume.
Yeah.
Okay. So you have the departments. You have oncology, you have cardiology, orthopedics, what else?
Radiology.
Radiology, internal medicine.
We're quizzing him. Look at him. He's at school.
Oncology. No, I forget. There's so many. I don't even remember who we've mentioned all now. And we have critical care. We have criticalists there, and we're open for emergency 24 hours a day.
Wow. Is it busy there 24 hours a day? Or?
Yeah, it depends on if it's a full moon or not.
Yeah, you never know.
I never know.
And how many people do you have, say, on staff at 2 o'clock in the morning?
Well, we always have at least 2 doctors on the premises, and usually at least 3 to 4 nurses.
Wow.
Even at 2 o'clock in the morning.
Of course, you're doing rounds with the patients that are there too, and making sure that everybody's good and
yeah, which is part of the reason why we have 2 doctors at all times, because that way, even if someone is seeing emergencies at any time of day, there is at least someone who can still be monitoring the critical patients.
Okay. Now, the next thing that comes to mind is if I am sick and I decide to go to Cedars-Sinai and I'm not insured, well, I don't know if they'll take me, but the point is it costs a lot of money.
Yeah, absolutely.
I know that animal health care has gotten quite expensive. What's the situation there? I mean, first of all, if somebody comes in for emergency, something's wrong with their dog, and they come in and you've got to see it, and the dog's there for 4 hours, and you're checking into it. What kind of if you don't mind me asking, what kind of bill are they going to walk away with?
No, I mean it's a good question because it's certainly with the economic situation the last couple of years, it's difficult when people come in. The thing with our hospital is that people, when they come to ASEC, they expect the best care. They really expect the best technology.
Right.
We provide that. They know that comes with a cost. We have a CT scanner that we can run on emergency if we need to. There's a lot of cost associated with that. So when people come in, they realize that there's a cost associated with getting the best care for their animal. And what we do is, we certainly take all kinds of health insurance, and we try to work with people as best we can to give them the best care that they can afford.
And they can probably do payments in a payment type of plan, or that you don't know.
We have various credit options, that they can apply for.
Well,
let's press them a little more on this.
Yeah, I know. We're going to leave them alone about cost. No, it's just curious because there are people that's their concern. That's why we ask. It is something because you want the best care.
Yeah.
And you're limited, but you do the best you can. So.
Yeah, no, it's a very valid concern, and I think people just need to realize that there are costs associated with treating the animals, and unfortunately we can't treat everyone for free. We would
As
love to.
my mama says, Raviv, you get what you pay for.
Exactly. She knows what she's talking about.
That's right.
Last week we had a story that we discussed, and I forgot what the percentage of people said that they would spend more or put their dog or animal's medical care costs ahead of their own.
That's fantastic.
Well, it's good for you.
I love to hear
you
that.
love that. And his smile got real big after that.
But he's in it for a reason, right? You're there because you love the animals. And to hear that is a good feeling.
My job is fantastic, and people ask me all the time, would I rather be a human surgeon? And never. I love my job. Getting to see how happy I make families when they have their dogs. They come in paralyzed, and you do surgery on their back, and 2 weeks later these dogs are walking. There's just no joy like that.
That is incredible. It's so good. I'm so excited to know more about you guys. I'm like, I know where I'm going. But is there a rehab facility there as well? You do rehab there as well, or
no? We don't have the space in our hospital to do physical therapy because now it's really people are doing swimming and underwater treadmills, and it's become a very advanced thing. So we work with all the physical therapists in Los Angeles, and we make recommendations when we feel animals would really benefit from getting physical therapy.
What the best place for them to be would. Or to go, you have that in your back pocket, how to help us out.
Absolutely, and when it's appropriate.
Well, I like that. I would like to have some water therapy. Well, humans are walking in. Now this equipment, the CT scanner, this is human, like what we use in human hospitals as well?
Yeah, absolutely.
Use it on the animals?
Yeah, this is a CT scan, digital radiology.
All right, tell me about this
ultrasound.
Newport E360 critical care ventilator. I saw that, and I mean, it says that you're one of just a few places in the United States that have this for animals.
Yeah, this is a great ventilator that our criticalists use, and we actually have a lot of hospitals in Los Angeles who will refer to us when they have cases that need to go on the ventilator. Sometimes dogs, either with really severe pneumonia or smoke inhalation, or cases where they just really need to be on a ventilator for days. Sometimes we can handle that.
Now, you mentioned smoke inhalation. Everybody's seen on the news when there'll be a fireman pull out a kitten or a dog, and they'll put the mask on, and they'll be blowing into the face and trying to get the animals going. And of course, everybody loves to see the happy ending to that. Do you find that there's certain areas of your medicine where maybe even as recently as 5 or 10 years ago, the success rate was pretty low when you treat it, and now that it's gotten more technically advanced, that you see the success rates improving?
Yeah, absolutely. I mean, almost across the board.
Really?
From my specialty, orthopedic surgery has gotten so much better in the 10 years since I came out of my residency. To now, we're doing so many minimally invasive procedures, very similar to they do in people. So we're able to do a lot of procedures that when I was learning were very big surgeries, and whenever you do big surgeries, they're associated with complications. And when you start doing minimally invasive, kind of mimicking some of the procedures in people, success rates go up, and there's less hospital stay and less cost associated with it.
So basically, we're doing human testing for animals.
That's right.
You know?
That's one way to look at it.
Yeah, I like that. Hey, when we come back, of course, we're going to discuss a little bit more about you, but I have a question, too, about Class 4 lasers after that. Well, welcome back. If you're just joining us, we are in studio with Dr. Raviv Balfour from ASEC. And I was asking before the break about Class 4 lasers. We read about that maybe 6-8 months ago, and we actually had someone on the show with us that was talking specifically about it. But it almost sounded like a miracle device for helping arthritis, and I was just wondering what your experience with it is.
I'm interested to hear this.
Yeah.
Yeah, personally, I don't have a lot of experience with it. I certainly know about it, and I know it's being used out there. There's people who advocate cold laser versus hot laser, and, it's basically what you're talking about. But, it tends to be more with the therapists, and with the treatment of arthritis, it's a multimodal approach, with medications and rehabilitation and pain management, such as with acupuncture or with lasers. But it's I can't talk about it from my own personal experience.
I am curious. So when you say arthritis as opposed to hip dysplasia, which I'm sure you see so many cases of that, I guess the hip dysplasia can cause arthritis, but not the other way around. Is that a right way to say that?
Yeah, that's perfectly how you say it.
Look at me, I'm part vet.
I'm so impressed.
Yeah, I mean, hip dysplasia is when you have incongruity of the hip joint, and whenever you have a joint that's not normal, either incongruent or doesn't fit right, or there's been trauma to it, that leads to arthritis. So arthritis can't cause the hips to become incongruent, but when the hips are incongruent, it can certainly lead to arthritis.
All right, you're talking to somebody who's dealt with a lot of dogs, a lot of them having dysplasia, and a lot of them developed into arthritis. My 11-year-old dog is a little bit arthritic now. I still don't really understand what that actually means. Is there a simple way to explain it?
Well, basically what it is that the hip is a ball and socket joint. And when that ball doesn't fit into the socket real well, because when they walk, it pushes the ball out of the socket a little bit. Well, the joint doesn't like that. It wants to try and stabilize that joint, and how it's going to do that is to thicken the joint, and that's arthritis.
Oh,
and what's it thickening it with?
With scar tissue, trying to stabilize that joint, you get bone production, you get thickness and fibrous and scar tissue of that joint capsule.
Almost every older dog you see has some form of it. That's just aging in general, right? I mean, it's almost at a certain age you see them start to kind of walk like an old person, or less nimble.
Yeah, I mean, it's certainly not all dogs have hip dysplasia, but, just like in people, as they get older, because there's wear and tear on the joints, certainly a fair amount of them get arthritis in the hips.
Right, and so most of it is done through medicine, like you said, multimodal. That's my new term, multimodal, Raviv. You're very fancy. Multimodal.
Yeah.
But so you do medicine, but would you say that working like your micro lasers, is that right, micro laser?
Sure.
Small laser?
Sure, whatever.
Whatever. Don't make me talk vet more than I need to. It's all you. But whatever, the minimal invasive, that's what it was. Can you do that kind of thing for that?
Not really for the hip joint, because what happens is when they start developing arthritis to the point where medication and rehabilitation and your acupuncture and so forth aren't working, we're really looking at doing surgery to relieve the pain, and then you're talking about your surgery such as total hip replacement.
Oh my Lord, yeah. I would do it though.
Yeah. Oh,
Yeah.
I would do it. And I'm already, starting to put my pennies aside for this.
Yeah.
Yes. Now, more on a personal side for a minute. When you decided to get into veterinary medicine, well, first of all, what was it that actually? I don't know. With most people, I find that there's one standout event in their life that helped them go a certain direction. Do you have something like that?
Yeah, it's funny you should ask. I still remember. Back when I was in about second grade, we had a couple cats growing up, and grew up in the south suburb of Chicago, and our cats were outdoor cats, and came home one day from school, and I remember seeing our cat had been hit by a car on the side of the road. And, here at in second grade, I decided I was going to be a veterinarian at that point.
Really? That
Yeah,
fast?
that was
Wow.
the standout event.
Well, it's so wild because some kids may go, like me, would have gone the other route of, oh my God, it was all emotional, but yours was like, how do I fix it?
Yep.
Which is really lovely.
Yeah, well, I actually, my personal physician, he loves animals. And every time I go to see him, he's always got some new animal that he's gotten that he shows me a picture of. Or one time I went there and he had a new sun conure in his office. He said, oh, come here, you got to see this. And I asked him one time, I said, with the way you love animals, I said, did you ever consider being a veterinarian? I said, he goes, I could never do it. I said, what do you mean? He says, well, when you have a human patient, if somebody has cancer and it's terminal, I can sit down, I can explain it to them, and they're not happy about it, but they can process the information and deal with it. They understand. When you have these poor animals, they have no idea what's going on. They just know they hurt and they don't like it. And he said, I couldn't deal with that.
True, but at the same time, I feel like I have a gift because I'm the advocate for the animal, and I get to basically speak for the animal, what I feel is best, and give my recommendations. So I think that it's difficult, but at the same time, it's really fun to be the advocate.
I would also say that what we say all the time is dogs live in the moment, whereas it's usually the humans that you're having to deal with that are emotional, that are stressed, that probably our stress leads to more stress on the dog because the dog's they're just living their life in that moment. The minute they're out of that hospital, they may not feel great, but they're not stressing or worried about dying, none of that. So
yeah,
that's a positive side to
that's
it.
part of the reason why I think dogs heal up from surgery so much quicker than people is you take the mental component out of it.
Yeah. There's like, what's next?
Yeah, they're raring
Is there
to
a
go.
ball I can chase?
Exactly.
Yeah, that's very cool.
All right, now I have another thought up here about when you have these animals that you're trying to help. And I'm sure you see a lot of animals that, the prognosis is good from the beginning. Sometimes not so much. It's, not sure which way it's going to go. But do you have a sense that the animals know that you're trying to do something good for them? Because I know, like with dogs, you have a dog that's in pain because maybe he's got a broken leg. You go to see if you can help him. They'll turn and bite you. Not because they want to bite you, but they're in pain and they want to be left alone. So I'm just wondering if you ever feel that.
Yeah, I think sometimes.
Yeah.
I mean, I think sometimes, I think the dogs don't realize and they just can't wait to get out of there. But I think sometimes you can really see, especially when these dogs come back for rechecks, how much they appreciate, what's been done. And, I have plenty of dogs who, you were talking about before about, behavior modification to help get them in the car to come to the vet.
Right.
I have so many owners who can't believe that the dogs are pulling them to come into the hospital sometimes.
Really?
And those are the dogs that, maybe they do realize, like you're saying.
It was a good thing that happened here. Yeah.
Yeah.
Or they just liked your smile.
Well, it's a
Or
good,
the treats I gave them.
That's right. Well, it's a good testament that you're kind and how you handle them because you're dealing with really some things that are very traumatic, and so the fact that you can bond with the dog through that is really cool. That's really great.
Oh, yeah.
Yeah.
Are the hours killer for you?
Not for me as a surgeon, but I'm sure for our...
Because your time's scheduled pretty much all the time.
I work during the day. I mean, I am on call sometimes so we can do emergency surgery if needed in the middle of the night. So there are times where I end up having to come in the middle of the night to do that. But most of the time, I'm there during the day.
Wow, that's
Man,
good.
I can't imagine trying to wake up and, oh, wait, let me cut open a dog. I would just be so...
Yeah, my
That's
residency
really
trained me for that.
I
There
bet.
were plenty of times I would come in and do surgery all night and then have to be there the whole next day. So this
it's
is
just like
easy
a
now.
doctor. Yeah, just like a human doctor, the same thing. So you have pets of your own?
Yeah, I've got 2 dogs, 2 cats.
Oh, my gosh.
Yeah, and they're all rescues from various things. But a Labrador who's a complete knucklehead, and
And which ones aren't?
yeah, exactly, and a Shepherd mix and a couple of cats who we rescued in the hospital.
And your career allows you time with them, which is you said you take them to doggy daycare.
Yeah, the dogs go to doggy daycare during the day because unfortunately we don't have the room to be able to bring them to the hospital every day. But certainly when my dog tore her ligament in her knee, there was certainly some. But no, my Shepherd mix. She hopped in the car and we took her in and did the surgery that day.
Did you do it yourself, or do you have somebody else do it?
Nope, absolutely, I did it myself.
It's interesting because, like with humans, they won't let them operate on their family, right? But there's no rule on that. You're like, out of the way. I got this.
Yeah,
Plus,
exactly.
you like that kind, the knee stuff.
Yeah, exactly.
It was one of your favorite things.
Absolutely.
So, go ahead.
What is the most Well, first of all, you deal with lots of different animals. What's the most unusual animal you've had to treat?
I mean, I'd say that the vast majority of what I treat is dogs and cats. So doing exotics, I don't know much about exotics. It's very rare to deal with exotics. But every once in a while, we will get a lion or a tiger.
Really?
That I can actually sometimes work on because they're like big, very big cats. Yeah.
Why would you like from the zoo? Not people keeping them as pets.
No,
I was just wondering, local neighborhood. You know?
I mean, there's a lot of rescue groups in the area that we will sometimes work with.
Film, probably film stuff.
Exactly, film. And when I was back in Boston, there was a wildlife rehabilitation center. So during my residency, I've gotten to work with a black bear cub and a wallaby and a bald eagle. So some various animals, but very few and far between. I leave that to the people who really know about exotics.
Mm-hmm. And what's the most unusual case or ailment or something that you actually had to deal with?
Well, I mean, there certainly are crazy things I see all the times with dogs, but I think, the things that tend to stand out in my head are the foreign bodies that dogs eat.
Yeah, I was about to say, what do you see in the belly?
That always amazes me. And I had one dog once that came in and ate an esophageal skewer. Ate a skewer for a barbecue and had swallowed it right down his esophagus like a sword swallower.
And it went all the way down?
It was just poking all the way down the esophagus on this x-ray. It was unbelievable, just like a sword swallower.
Oh my God. So it didn't poke through anything? Just
not at all.
In.
We were able to anesthetize the dog and pull it right back out.
Seriously? So no surgery?
No.
Oh my God.
It was amazing.
That's like one of those ones where you see the x-ray of the guy with, like a pipe through his head, and it misses everything.
Or an arrow, yeah.
Yeah, an arrow, that's right. So anyway, we are out of time, I'm sorry to say, but we're going to do Dogs and News, hoping you might hang around.
Absolutely.
With us for that.
Love to.
Pipe in, please.
You got it.
You're listening to Atomic Dog Radio with Jillian and Russ, right here on LA Talk Radio.